IMEDS was put together. Reagan-Udall's created a public-private partnership to run IMEDS, and IMEDS is trying to take the methods research component of OMOP, and which had been at the Foundation for the NIH, and it had a methods research lab, which we've now moved over to Reagan-Udall, and then we're trying to use the mini Sentinel program from the FDA, which has a tremendous, I think it has 180 million lives in that data set. It's a distributed database of 19 data partners. And so what we want to do is create methods in the lab that can then be used to better understand the claims in electronic health record data. The data is not generated for the use that we're trying to, what we're trying to use it for. So the problem is, how do we know what's real? When we look at all that data and we try to look at it statistically, how do we validate that what we're looking at is real and not just a false positive or false negative? And so that's the trick, is figuring out what can we actually learn out of all of this data. One of the core capabilities that's going to be part of Reagan-Udall probably forever is going to be methods development, because it's a very specialized area, and it's something, now that we're getting into all this big data, this is really needed. And I'm interested that some folks who are gathering large sets of data don't even know yet that there really aren't methods yet to validate any of the conclusions they'd like to draw from the data. It's much harder than just applying statistics. You're bringing disparate sets of data together and trying to make sense out of them. We have a very large vocabulary set that we maintain, and while that sounds like a list, it's actually much more comprehensive, and it has common definitions, it has metrics with it, and so a lot of people, thousands actually now, of organizations have downloaded that and are now using it as their vocabulary from which to work. So maintaining that, and then the other is the common data model. So you think about it, you need that framework, and we need to start, at least some people need to start getting on the same page. How are we all going to work together if you have a different, if you call one thing something different than what I call it, and you're using a different model, then we'll never be able to harmonize any of this stuff and utilize. So part of what we're doing is providing common data model and vocabulary, as well as the lab.